This is an instructional video about how to set up a percutaneous endoscopic gastrostomy, otherwise known as PEG, bedside procedure. During this procedure, a feeding tube is inserted through the abdominal wall into the stomach under endoscopic guidance to provide long-term nutritional support. As previously shown, ahead of any procedure, written and verbal obtained informed consent should be gathered by speaking to the patient's legal power of attorney. Next up, we will be ordering 6 milligrams Versed as shown for purposes of sedation and anxiolysis during the procedure. Fentanyl will be ordered, 100 micrograms, to provide analgesia. Lastly, to provide muscle relaxation, 100 milligrams of rocuronium will be ordered. It is important that these medications are ordered before the procedure, either the morning of or the night prior. After ordering the desired medications, the nurse should be called promptly to let them know what time to expect the surgery team approximately, so the nurse can draw up the medications to waste no time in getting ready for the procedure. As well, respiratory therapy should be called in order to have the vent on correct settings. Let's hear from Ashley Mila Hoff, Chief Resident and expert PEG Tower Setter-Upper.
5 hours later.
Literally all used. What the hell? Literally every single one is used. I've never seen this before.
An eternity later.
Okay, so once you plug it in, if this is in green, you press it and then it turns green, okay? And then this should be green, this should be green, and then you have to turn on your screen. And then air has to be on. Well, I'll have to plug it in first, so I'll show you this. So then you're gonna get this big thing, and you're gonna plug it into here, like this, with a dot up or down. Usually it's a dot up. Yeah, dot up. Then this has to go in here. It has to go up, and then you turn it, and then it goes on. Okay? Then you steal the suction. Oh, that's in the suction. And you get the suction on here. Okay? Now you have to make sure the air is on, the light is on, and your suction is on. Then you steal a box of 4x4s. Okay? Box of 4x4s. You donate the fluff to whoever's scoping. Well, not if you fall on the foot. You usually donate the fluff to whoever's scoping, and you fill the rest of this little cup with saline. Just a little bit. Now you use this to run your tests. So you put your little cup of saline in here, try not to let it spill, and you run your test. Before you run your test, you're gonna look at your scope. Do I have a red button? Do I have a blue button? Because these can come off. So sometimes they're not there and you have to get one. And then do I have this plug? These plugs also come off. There's a bunch in the little side thing. So you're gonna put the end of your scope in the water. You're gonna tap, not push. You're gonna just rest your finger on the blue. Are there bubbles? Yep. There's bubbles. And then you're gonna suck and you're gonna watch the water level go down. If the water level starts going down, looks like it is. So now I know I have light, I have bubbles, I have suction, my scope is ready. I gently place this over here at the head of the bed, scoot this all the way toward the patient, and then bring this all the way facing the head of the bed. Until you do all of that, the peg's not set up. Okay.